flow. Hear the laughter, start your day with Cribside Chatter.
Good morning, team. I'm your host, Renee Johnson, on the Cribside Chatter, and we've got some exciting updates from the Allo Immunization Committee that had representations from labor and delivery, mom, baby, and NICU. Grab your Diet Coke or your coffee, and let's dive in. Today, we are pleased to be joined by Nancy Braithwaite, the labor and delivery educator and Allo Immunization content expert here at Intermountain Medical Center. Nancy, why are we discussing Allo Immunization today?
Great question, Renee. We're focusing on allo immunization because when a patient has antibodies, it can lead to serious complications for both mother and baby. Early identification and coordinated care are critical.
So what big news do you have for us today in the crib?
The Allo Committee has developed a streamlined, proactive approach to managing allo immunization. It starts with our maternal fetal medicine team. They will send us a list of patients who have positive antibodies. Then our amazing L&D practice share leader, that would be you, Renee, flags these patients by marking allo during induction scheduling. This ensures we're prepared when the patient arrives. But we know that not every patient follows the plan. Some may arrive without prenatal care or from care from an outside system. That's why the next steps are crucial for every patient who walks through our doors.
What happens when a patient presents to labor and delivery?
First, we check if prenatal labs were drawn at an Intermountain Health lab, or if there's a prenatal record. If not, the labor and delivery nurse will draw a type and screen and wait for the results. If labs are available, or once the results are in, we check for antibodies. If no antibodies are present, we proceed with standard delivery care. However, if antibodies are present, we need to dig a little bit deeper. If they're due to ROGAM, no further action is required. If not, we follow the new algorithm, regardless of the antibody type or titer.
What does this process look like?
Once antibodies are confirmed and not ROGAM related, the primary labor and delivery nurse has a few items she needs to complete. She will double check the labs in the system to make sure they were transcribed correctly. She will then inform the charge nurse, who will write allo in all caps on the patient whiteboard to alert the L&D, NICU, and mom-baby teams during board report. The primary nurse will then notify G2 nursery nurse via Vocera, who will then contact the newborn provider for verbal lab orders. Next, she will order a type and cross for 2 units of red blood cells, just in case a transfusion is needed. And lastly, she will gather the supplies needed at delivery. Now, we've gone ahead and prepackaged these supplies in a bag that you can find in Big Bertha in the non-part items just to the right when you walk in on the bottom shelf. This bag includes all the supplies you need and detailed instructions on how to draw these newborn labs.
And what happens once the baby is born?
Immediately after delivery, the L&D nurse collects cord blood as usual and then draws the newborn labs from either a cord segment or placenta, redrawing if there's clotting. At the same time, the second nurse will notify the HUC to admit the baby and alert the G2 nursery nurse to place the lab orders. These labs need to be drawn and sent immediately.
This is incredible, thorough, and thoughtful system. Thanks for breaking it down for us, Nancy. And as it happens, we have got a patient with an antibody about to deliver. Let's see this new process live in action.
Sounds great.
Are you feeling a contraction?
Okay, here we go.
Okay,
Let's push.
push. Okay, our head is out. And she is here, but I think she looks pretty floppy and better go over to our second nurse.
Delivery's at 1857.
Okay. Fine, labor and delivery HUC.
Hi.
Hi, we had a baby girl in room 13 with Dr. West at 1857.
Okay, I have a girl at 1857 with Dr. West in room 13.
Correct.
Perfect. I will get her admitted.
Okay, thanks. Fine, G2 nursery nurse.
Hi.
Hi, baby Alme was born and we need her orders entered. I'm missing the labs immediately, so the results will be ready in 20 to 30 minutes.
Okay, that sounds great.
Do you have the tube for the cord blood? Thank you.
Welcome.
There you go.
Thank you. Can I get a cord segment, please? There you go. Thank you. I'm going to draw these labs. I need at least 1 mil. And I'm going to start with the green micro tainer. I need to fill to the top line. My second one is the lavender, filling that one also to the top line. I'm going to agitate both of these back and forth. I'm going to print a label. I'm going to mark that it was drawn off of the cord. Nicole, do you have time to verify that this is the correct patient?
Yes, of course.
All right, this is baby Alome, born today, and it was drawn off of the cord segment. Okay. Can you send these immediately for me?
Of course, I'll send it.
That does seem easier than I thought. I just have one clarifying question. Who will follow up with these labs that were sent immediately.
The E2 nursery nurse will be watching for the lab results and follow their process based on lab values.
When do you expect this process to be rolled out?
June 2nd is our go-live date.
Thank you for all this exciting news and updates. So whether you're on days, nights, or somewhere in between, know your voice is shaping safer care for our patients. That's all for today's Cribside Chatter, where the news is always newborn friendly.
Tune in bright and feel the glow. Cribside Chatter's your baby show.